back to the Beauty Lab podcast. I'm your host, Velia, and this is my co-host, Monina. And today we have an awesome guest, Dr. Rajinder Rai.
Dr. Rajinder is a pharmacist, midlife coach, and the founder of Sunrais Health, a platform dedicated to helping women in their 40s, 50s, and beyond to reclaim their energy, confidence, and joy. With nearly 3 decades of experience in pharmacy and functional medicine, she saw how women's health, especially in midlife and menopause, was too often dismissed. That inspired her to create a new model of care that blends medical expertise with self-care and soul care. Through her signature framework, Dose of Pause, and her community, My Sahele, Rajinder provides women with practical tools, trusted guidance, and a supportive space to thrive in this new chapter of life.
Enjoy the episode.
Welcome to the Beauty Lab podcast, your drive time resource for all things beauty, health, and wellness. We're your hosts and favorite beauty nerds, Monina and Velia.
Join us as we debunk myths, explore the latest trends, and dive deep into the science behind your favorite products. We'll interview industry experts and answer your burning beauty questions in 30 minutes or less. Welcome, Dr. Raj. Thank you so much for being here with us today. So my first question is, you've had a very long career in pharmacy. So what inspired you to start focusing more on women's health in midlife in particular?
Yeah, thank you. Great question. And thank you for having me today. So I have been a pharmacist, community pharmacist for almost 3 decades. And so I have helped patients 0 to 100 with everything in between acute care, chronic care to long-term care. And it really wasn't until I started exploring my own midlife journey in health that I realized that if I'm going in as a pharmacist with the knowledge and questions and access that I have, and I still felt like I was getting basically, everything's fine, labs are normal, we'll see you next year, and no kind of information as to what I should be expecting, what I should do next. What is the average woman kind of experiencing? And even in my pharmacy world, it's very symptomatic. You come in for a certain symptom, your medications are for that, we go over that, and there is not really whole body care. All of the, doctors you may go to may or may not communicate. So what's happening in one part of your body may not be communicated with the providers that you have. So I really felt that there was this gap of information, gap of care that women, especially during midlife, needed to really have someone put the dots together with them. And it also happens to be when a lot of things are changing. Physically, hormones are changing, relationships transitionally, you may be changing. You have kids that are leaving for high school, college, you have aging parents, you may be in mid-career shifts. So there's so much happening all at one time. What do you focus on? What comes first? What comes second? It just felt like there was a need where I could shift over from being behind the counter and more really in a educator, curator role for women in midlife.
Wow. Yeah, that makes a lot of sense. So what would you say one thing every woman in her 40s and 50s, or what you would consider midlife, understood about their health?
Well, one, if you're living long enough, you're going to go through menopause. And so those hormonal changes that we think we only need to know hormones when we're in our reproductive stage is what's a myth. Hormones start changing as late as your 30s, early 40s, and a lot of the things that we as women brush off, feeling tired, not sleeping, even anxiety, weight gain, could all be attributed to those hormones that are shifting. And we, again, are so conditioned to think that this is the way it is, that this is this, I just need to get by because I have so many things to do. You don't want to think about it, that you do need to pay attention. If your body is sending you a cue or a message because you're not feeling well, then that means it's time to pay attention. It's not when you need to. So
Yeah, we actually got to listen to you on an event that you put on at the beginning of the year, and that was the first time that I really realized, yeah, there are those cues that it never even occurred to me that it's my body changing and most likely my hormones. And because of you and all the things that you explained during that event, I actually went and started talking to my gynecologist, and I actually started HRT. And it's amazing how just tapping into that one thing has really started to change how I look at aging and how I feel about myself now. So yeah, I'm so excited to see that more women like you in the field in your industry are starting to really bring that to the forefront and allowing women to actually, you're starting to help us advocate for ourselves so that we can actually go and talk to our doctors and not just get the, oh, you're getting old, and and go home and be satisfied with that. So I really appreciate that. Now, in addition to all that you've done so far, I have another question, because you said you also worked from 0 to 100 people in their much later years. So after working with people later in life, how has that shaped the way you encourage women to take care of themselves early on in life?
I mean, I think it's, our health is a slippery slope. It's like you're perfectly fine, especially for women when they come into midlife. It's like, you're perfectly fine and boom. And I've noticed it,
Yes.
over and over again, because you were, again, conditioned to just keep pushing through and you don't realize all the changes that are happening. And it almost now started, when I look back, like clockwork, women that were very high functioning, running a lot of things. They're either having their own businesses, companies, even busy moms. They're, not putting themselves first. And then I would see them during the week taking care of something for their family. The Mondays, I would see prescriptions coming from the ER because they ended up in the hospital with a heart attack or stroke or something like that. And they're like, I don't know where this came. I was perfectly fine. And then all of a sudden they become, instead of the caregiver, they become my patient in the pharmacy. Now they've gone from taking 0 medications to 6, and one thing after the other, and it's very common for women when they're in midlife during this transition of perimenopause to menopause that their cholesterol goes up, that they have high blood pressure, hormones are depleting, but the risk for especially cardiovascular disease is starting to increase. And especially for Asian women, South Asian women, we're already prone to cardiovascular risk more so. And it's unfortunate. And even last year, I had a very close friend and colleague where her and I were walking. She was a diabetes specialist. And at 45, she had sudden cardiac arrest without any warning, without any, indication that she needed to get in and get checked. So sometimes things unfortunately happen so quickly because you don't know. Working again with patients that are in long-term care, going from being perfectly fine and then needing care towards the end, there's so many things that could have been done preventatively, especially for women. Another aspect is that women end up having urinary problems, incontinence, which then keep them from being mobile. They don't want to go out. They're afraid of having accidents or just not being around anyone because, they can't travel long periods of time. So then that creates the isolation. And then that causes a chain of other problems, depression, anxiety, loneliness, all of that happens. And we've seen it where, our patients have moved from stage to stage in their health journey. But something like that, if there was education on pelvic floor health, we could prevent it. Or even if you're at that stage, there are treatment options for women so that it doesn't escalate into problems where you're like housebound. So all of those, again, caring for patients that were already past certain conditions and then they've become chronic, I have the perspective of helping, like, okay, how can we go back and be more preventative so that we're not getting there? And to be honest, I've been fortunate to have patients that are ill at later stage, but also I've celebrated many patients that have hit their centennial birthdays as well too. And it's amazing to see how there is a pattern of my patients that I've had that were still active, socializing, having, almost like having autonomy over the things that they were doing, that they were were my patients with the least number of medications, because they still felt control over, what they were doing, how they were doing, where they were spending their times. And they still had this like positive outlook for what they were doing in life. And the most important thing was they didn't care about what other people thought. It was like if their kids came to visit them, great. If they didn't, fine. They were content in having their own life, and they weren't dependent on that. And I thought that was interesting in comparison to some of my other patients where their health did decline because they were just very much more dependent on the system and other people kind of taking care of what was happening with them.
Yeah. I learned so much from that conference that Monina was just talking about, just about how your menopausal symptoms are so different, or, depending on your ethnicity. And I know you touched on that a little bit, but there's all these things are kind of running through my mind as you're talking. And I don't want to interrupt you, but what you're sharing with the world and with women is so incredibly valuable. And I'm just so happy that you're one of so many genius women that we've been able to get ourselves in front of, because we're at the right age for that too. So on a very selfish level, I'm happy to be talking to you right now. I do have a couple more questions for you, but if you're at home and you're listening to this and you're in your 40s, your 50s, even earlier in your 30s, and you can think of somebody, if it's not yourself, that would benefit from this information, like Dr. Rajinder said, every single one of us as women will, as long as we live long enough, will go through perimenopause and menopause. So if you can think of anyone, please share this information with them, like subscribe to this channel, download the episode. Somebody in your life will need this information. If not every woman in your life will need this information. Okay. The next question that we have for you is, why do so many women in midlife feel like they're, doing all the right things, but still don't feel great? And what can they do to kind of turn that around?
I love this question. I think that the main thing is that we are so kind of put in boxes, and that there's protocols as to like one size fit all. And I think, especially being a compounding pharmacist with that, is like there's precision in the care that we should be receiving. And I think women, once, like you were talking about, being empowered to go and talk to your doctor and ask questions. And if you're not getting the answers from that particular doctor, maybe they were a great doctor to deliver your babies, but now maybe it's time for you to find the right provider that's now going to take care of the care that you need in midlife. And like you said, there are so many amazing providers out there, and that's one of our goals, is to make sure women are connected with the right services and products that they need. You have that choice. You're not stuck with one provider. And my other goal is for women to understand that there is what we would call conventional medicine or traditional medicine, but there are other alternatives. So maybe HRT, like Monina, for you, it was great, but for other women, it may not be the solution for whatever reason. There are other solutions out there. And I really would recommend women choose a provider that's open to alternatives, not just like this is it and only give you one solution. I think that's where I don't want women to feel like they're boxed in, where this is what they have to do because their insurance covers only this, or this is the only provider. I want women to be open to like really finding the right fit for them based on their specific needs, their background. You mentioned about culture and so forth. A lot of us, if, again, coming from Asian communities and women of color, a lot of times we don't talk about health in general, let alone talk about menopause or periods or any of that. And so sometimes we're conditioned to believe that we're not even supposed to talk about it. So if you can't talk about it amongst your friends or family, how are you going to openly talk about it to a provider? So unlearning some of that conditioning that we have, that this is a taboo subject, is the first step. And start talking between your friends, sharing the stories. And that's really kind of what we opened up when we had our event in spring is to make it to normalize that we all are going to go through it, but there are solutions that you can do at any age or stage. It's like, it's never too early, it's never too late to start. It's like what you do today is going to set your next decade. So if you're in, your 40s, it's like, how healthy will you be in your 50s? If you're in your 50s, how healthy will you be in the 60s, and so forth. So it's that journey that you decide to take from day one.
Yeah, that that event we talked about that you did in March, it was a big eye opener for me as far as the providers that you were saying, because I believe someone on your panel even said that only a small percentage of all the endocrinologists and gynecologists in the United States are even trained on menopausal symptoms. So, yeah, I definitely agree. People should start asking around, talking amongst their friends, and trying to find that provider that really fits their needs. So thank you so much for pointing that out, because it may be right now kind of more of a hunting for information and finding the right providers that even you could even have that conversation with. And I'm really thankful that you're here, because I feel like you could be a first touch point for a lot of our listeners, because you are a wealth of knowledge, but more importantly, you have so much background in this topic, and also the network that you have, because that was the most impressive part about your event, was you had panels of doctors and nutritionists and a whole gamut of people who really understand this journey of our midlife that you're talking about. And so on that note, I was wondering, could you kind of tell our listeners a little bit about, I believe you have another event like this coming up, similar, is that right?
Yes, we have Elevate Her, celebrating wisdom in womanhood. So the earlier event in spring was Woman in Bloom, which was like planting your seeds and so forth, about like gathering the information that you needed to really start that journey. And this was more of really taking a step and appreciating how far you have come, wherever you are in your stage, and then giving you the tools to be empowered for that next stage of whatever that may be for you. And so we again will have amazing speakers, lots of different providers with different specialties, from concierge medicine, longevity, Ayurveda, Chinese medicine, and even connecting women back into what I think is the most powerful superpower for women is Women's Circle. My goal with this is really to take women out of a box, a square, and put them back into circles like we have for centuries, culturally passing stories from generation to generation. Because I don't think, although I focus on midlife health and midlife women, but it's really that connection of generations that is important, that what we learn will help the younger generation keep those doors open. If we're healthy, then we can continue to support generations ahead of us when they're in their time of need. And so that's why I focus on women in midlife, because we are like in that sandwich generation. So really with this event is kind of like a culmination of where we've been and where we're going, and what do we need to kind of continue that journey and have a vibrant life, because it's not the end. For me especially, I feel like I'm a walking billboard of changing and pivoting at 50, and there's so much more I want to do, and my physical health has to come first.
Dr. Rajinder, when is this event, and do you have any room left for people who might want to attend?
It's September 27th at Westlake Inn, the same venue that we had. So it's about an hour north of Los Angeles. It's a great weekend to go and do like a girls' trip, because the venue is so beautiful. But yeah, so we can accommodate. We will open up more room
We're
if
gonna
needed.
link all the information, listeners. If you are interested, we're gonna link all the information in our show notes on how you can attend this, how you can get a hold of Dr. Rajinder and her network of people to help yourself on your midlife journey. Is there any final thoughts you would like to share before we close?
Yeah, I mean, what's coming to my mind is there's a lot of information available online. Who do you trust? Where do you start? You could be spending a lot of, time just spinning your wheels doing that. I mean, there is great information out there, but I think being in this room would allow women to really create those connections. One, you're not alone. Two, you may just meet your next best friend. You just don't know. And then like you mentioned, the speakers and the panelists and experts that we have are coming from all over, and to get them in one room on one day itself is a feat. And this time we actually are going to have amazing activations as well too. So it's completely about elevating her. So color analysis, find your fragrance, to amazing gifts that our brand partners are, generously giving. It's going to be not one day to miss.
Yeah. And, just as a testament to your last event, it is such an amazing energy in the room when you have a bunch of women who are all like on the same level, wanting to improve their health, improve their life, kind of break out of the box, like you've talked about, and create relationships and friendships. I can't even tell you, like, when I was in line in the bathroom, I never for 1 second was there like a dead silence. It was always like, "Oh, hi, I'm so and so. How are you? Like, where are you from?" It was a very approachable, happy, positive event, even in the restroom. So, and all very genuine
Right.
too.
Yeah.
Like everyone we met, we really had a great time meeting. And yeah, I can't say enough about your events.
It was just great. If you guys are in the area or can make it out there, I'm going to be going. So I'm really looking forward to it. And again, thank you so much for being here and taking time out of your busy schedule. Really appreciate you doing what you're doing and really being a voice and an advocate for all of us women in this time of our life. I really appreciate it. So thank you again, everyone, for joining us week in and week out. We so appreciate you guys coming here every week. My name's Mamina.
I'm Velia.
I'm Dr. Rajinder.
Until next time.
Keep exploring your midlife journey.